Well, major hospital systems around the state say they've had to close hundreds of hospital beds this year because of staffing shortages. And this comes as healthcare workers expect a rise in COVID-19 cases. Our Barry Mangold spoke with the State Hospital Association about the issues.
Amanda, although current hospitalizations from COVID-19 are not as high as they were this time last year, staffing levels have only gotten lower.
So that's really where our stress comes in, is, in the ER and having people held in the ER and then not being able to find an ICU bed.
Hospitals across Oklahoma are swamped, dealing with unvaccinated patients with COVID and a shortage of healthcare workers. Lawana Helsted is the vice president of the Oklahoma Hospital Association and says nurses are having to pick up extra slack.
They may be changing their staffing model, whereas ideally you would have one nurse taking care of one ICU patient, but they may be going to 2 or 3.
Health systems including Integris, Mercy, Hillcrest, and SSM St. Anthony all report their ICU bed capacity is between 95 and 100%, forcing some to wait for emergency medical care. The chief medical officer at OU Health says staffing is one of the key differences in the current surge of cases.
We have beds that are unfilled because we don't have med-surg nurses, we don't have ICU nurses, and we don't have respiratory therapists that we've got to have to be able to utilize all of our facilities, and we don't have that.
Doctors say almost every patient arriving at the hospital with COVID-19 has not gotten the vaccine. According to a state health department report from earlier this month, 85% of all COVID hospitalizations are unvaccinated patients.
We are trying to take care of all types of patients, regardless of whether they're COVID or not.
The CDC says 57% of eligible Oklahomans are fully vaccinated. Barry Mangold, Oklahoma's Own, News 9.